Andrew, welcome to the program.
Thanks, Matt. Great to be here with you.
Well, today's topic, of course, avoidable blindness. I guess, Andrew, just to start out with, usually I think about avoidable blindness. I mean, the first thing that comes to mind is cataract worldwide. We're always talking about the cataract backlog and how this needs to be addressed. But of course, Allergan is coming at different disease segments. So where do you think Allergan comes in order to help treat avoidable blindness worldwide?
No, look, it's a great question. And at Allergan, we've had a long history within the eye care community, partnering with both physicians and obviously patients to help deliver medical needs to treat conditions that certainly impact visual acuity and people's vision. Predominantly a pharmaceutical company in areas such as diabetic macular edema, in RVO. Our goal is always to try and have that remarkable impact on patients' lives and really helping them regain sight or maintain the vision that they have through some of these different innovations to treat different diseases within eye care.
Now over the years, it's very apparent that, industry commercializes these great innovations in eye care, right? But at the same time, a lot of times these innovations come out and they're really for the developed world. I'm curious, when it comes to avoidable blindness, is this something that we can talk about within the developed world, or do we need to talk about it mostly related to the developing world?
In undeveloped markets around the world, one of the changes or opportunities for Allergan now as a part of AbbVie being in far more markets throughout the world, where we have a real opportunity to bring these innovations to patients under developed worlds. What we see in a developed country with higher levels of medical and physician infrastructure, your ability to treat a patient more frequently is obviously greater. And in an underdeveloped world where you need longer acting agents so that in the amount of time that a physician can actually get to a patient is far more critical in order to maintain and sustain vision gains for sure.
Yeah, that's interesting because, we've been hearing a lot about the early intervention of glaucoma now with surgical methods. I would think that for the most part in the developing world, if patients have access to glaucoma care, they're still probably in the realm of things like drops. But I would think that as we move into the future, if some of these technologies could be rolled out to the developing world, then that would mean that better patient care could exist because, with sustained release or, the intervention of surgery, these could be more permanent solutions. Is that correct?
It's no doubt that the future of glaucoma therapy is moving more and more towards interventions, both surgically and pharmaceutically, while drops have done a phenomenal job at treating and maintaining lowering interocular pressures and reducing the risks associated with glaucoma. The drops are only as effective as patients who actually take them. And so making sure that we have these interventions that can help produce lower IOP over longer periods of time is clearly the goal and the mission that Allergan and AbbVie company continues to work at. I think the future within R&D and within other interventions will be drug-eluting products and bioerodibles where you are getting drug to the target tissue.
So cataract aside, if we really had to focus in on avoidable blindness in another subspecialty, so in other words, let's say not cataract, but either glaucoma or the posterior segment, if we had to choose one, what's the low-hanging fruit in terms of avoidable blindness, do you think?
And when I think about glaucoma, whether it's cataract surgery or whether it's drops or now some of the new inventions that exist, they're also capable of really having a very significant impact on patients and their vision. So while the products that exist in retinal disease and glaucoma are good at treating the diseases, they're not great at treating the diseases. And duration across eye care is probably the most significant impact that we can have of creating products that are not only efficacious, but last longer. And as we said in the beginning of our discussion here, that to me is a big unmet need, not only in developed countries, but probably even more so in underdeveloped countries where the access to care and the frequency to be able to see a physician is more challenged. And then, Matt, I think you think about, how else can a pharmaceutical company help in partnering with the community, with the industry, with patients and physicians alike, is continuing to try and develop new products and solutions for some of the disease areas that have been higher or more difficult to uncover and to solve for. Specifically, geographic atrophy, where we really don't have any products that are capable of really helping patients with the vision loss associated with GA. Neuroprotection from a vision loss standpoint is another one of these untapped areas.
Yeah, I remember probably almost 15 years ago now, going to a Unite for Sight mission in Chennai in India. And I remember one of the doctors there that was in charge of the program, I was kind of talking to him at the end of the program and saying, oh, yeah, really good work that you're doing here, right, with all this mission stuff. And he said, to be honest, this is just a Band-Aid. We're waiting for commercialization to come in to really solve a lot more problems. When groups like yours start to commercialize in new regions, then that brings a whole new set of principles to the area in terms of opportunities and things like that. So I'm hopeful. And I've also, by the way, started to see a leaf turn, I feel like, in Africa, where new media is there, new commercialization efforts. We saw the WOC there was last year. So maybe the frontiers will start opening up a bit more, and with the help of Zoom and things like that, of course.
Yeah, look, I mean, the world continues to get smaller, and even through the pandemic, it's gotten somehow smaller yet, to your point of using technology for a lot of increased ways of communicating with one another in a global sense. So, something I didn't mention earlier, certainly when we're talking about different ways that large industries certainly help, and within Allergan Foundation, that's now part of AbbVie, and the amount of philanthropic events and activities that we have throughout the world, certainly in underdeveloped countries, also does a lot to help advance and be an active partner in helping deal with serious unmet medical needs in vision loss and blindness. Beyond just the corporate responsibility, the individual responsibility of leadership within our space within eye care, I certainly am interested in finding ways that I can certainly put more of myself into that to help as well.
Right on. Well, Andrew, why don't we go to the pictures for a moment? Pictures of avoidable blindness related things from around the world.
No, I mean, look, it's just amazing the joy that you're able to see. And what I see beyond the patient joy that is clearly expressed in this picture rather, is certainly the medical workers that are behind her. Again, the thing that really makes me jump out of bed in the morning to work within this space is being closely connected, not only to patients, but also to physicians as well, who do just incredible work every day for their patients. It's what makes eye care exceptionally special. Wow. Bilateral cataract surgery for a couple in their first visit to vision. I mean, just the pride that you see here from, again, the physician's perspective, of being able to treat a couple with what I'm sure would have been certain long-term vision loss that's obviously preventable with the surgery, as you mentioned, in the developed world, is so frequent, so safe, so effective. And the more that we can get those types of solutions to people, that's exactly the types of things we should be doing.
Great. Well, this has been a pleasure speaking with you. Thanks so much for talking to us about avoidable blindness throughout the world and how to solve some of those issues. Wish you all the best and your personal and professional journey to keep doing that.
Thanks, man. No, look, it's really always great talking with you, Matt, and appreciate the opportunity to speak with you and look forward to continue working with you in the future.